summit. Well, Mr. Dmytro and the previous speaker, Volodymyr Martynov, have mentioned No Pain UA project. So chronic pain in veterans, and the floor is given to candidate of medical sciences, Lieutenant Colonel retired Valentyn Chernyshov, NGO Frater. Hello, dear colleagues, participants. I would like to thank the organizers, first of all, thank you, and all the previous speakers who have announced our project already. It's a pleasure. Briefly about myself, I used to be a military anesthesiologist since March 22. I've been a doctor of the medical station in a team, a brigade, combined brigade, the head doctor of the group. A couple of months ago, I had to retire, but I didn't stop. I talked and connected to my alumni, and I joined the NGO Frater, and this is the result. So this is about the problem of pain. It was mentioned numerous times today. Pain after combat trauma has some features, specific features, and that's what our national researchers' works show. If you don't provide adequate care, 70% can go into chronic pain, up to 83%. One more problem mentioned today as well, there is no good adequate follow-up. As soon as the patient leaves the hospital, is discharged with acute pain or non-chronic pain, then the quality of life of that person diminishes, decreases, and we need to do something about that, and that was also shown by our national Ukrainian scientists. So that gave the rise to No Pain project. So we developed a vision that all people suffering from chronic pain, not only chronic pain, just suffering of pain, need to know that there are places, sites where they can get help. They need to get this help and care. It needs to be efficient, and the pain shouldn't impact their quality of life. That's our mission, free of charge, to promote achieving our vision and goal. So we do it free of charge. So basically, we help the healthcare professionals to provide this care and help to the patients who are in need of that. If we provide this care timely, so the frequency of chronicity of pain can be decreased fourfold. That was calculated as well. So these are the principles based on which we work. Information. We need to promote this knowledge that pain needs to be treated. People who suffer pain do not quite understand that, so we need to make it actual, provide information about the sites and places where it is done, practical, educational, and training. We need to train and educate all stakeholders. Scientific approach towards learning and knowing the situation. So unfortunately, we have a unique situation globally. So the correct approach towards data, research and scientific data is wonderful, and we can share the data with the rest of the world, and we need to do it evidence-based, because if there will be another conflict of such high intensity, other people in other countries should know how to do that. And integration is of paramount importance. We don't just be on ourselves, by ourselves. We would like to be integrated into all other initiatives, governmental, non-governmental, that are there, or initiate developing or creating some other initiatives. So we are ready to support and cooperate in this direction. So who are the main beneficiaries? So those who have combat pain and suffer of pain, of course, it's the state itself, because the state will get direct and indirect benefits of correct treatment of chronic pain. In particular, it's really important to pay attention to family members of those people who suffer of pain, because they do suffer as well, just as much as those who suffer of their pain. And of course, lastly but not least, the doctors who require support and help from their colleagues and obtaining quality information. I know it, like I have experience of that. I had to get advice from the field with regards to pain treatment. There were some soldiers coming from the United States. They've received certain therapy for chronic pain, and we need to understand what to do and continue to do with that, with the medications that we have here. This is our roadmap. Some of that is done, some of that is just planned to be done further. Would be nice to unite and develop the national wide program to help veterans with chronic pain. Currently, we also plan to do some education and training, but this is our flagship project that we have already implemented, and we've launched it in July. In particular, this is Stop Pain UA project. It consists of two components. The first component is the website, and there is a link to that website in all of our leaflets or other informational products. It's in our Facebook page. A person who needs help gets there. From recently, we also invite healthcare professionals there too, those who are interested in getting consultation and advice for their patients. Because after we've launched the project, we had some feedback, and we understood that the patient themselves are not ready due to many reasons to get connected to getting help. They don't understand, or they don't have the technical understanding, knowledge, or technical means, or not enough digits on their hands to get to the link. And now we have the option from until recently to get consultation for your patient in our chatbot. And in order to get to that website, so you can use QR code, or in Google, you just search Stop Pain UA, and then it'll send you there, refer you there. And this is our chatbot. Both patients and healthcare professionals can go there. Later on, then there is a short, brief interview or a questionnaire as a specialist, or if it's a patient, that the patient questionnaires then are there. So personal data are added there, and then the processing of personal data has to be agreed to. Then some professional aspects need to be mentioned. So visual analog scale intensity pain, DN4, neuropathic pain scale also is used and measured. And then the patient or the healthcare professional chooses the convenient date, and it's not the same day, because we have experts, and the pool of experts that we are working with are specialists who are professional, very professional in pain. In particular, Mr. Goroshko, who is working in the main military hospital, and he is in charge of pain treatment, and also other people who have huge experience in pain management. Would like to mention we'd be interested to cooperate with other experts from other healthcare facilities, but so far we don't have enough staff capacity. We wish we would be able to invite other experts, but still we are thinking about that, so I'll tell you later on how to contact us with regards to that. These are the KPIs, and the main goal and the result of our work is to make the quality of life of our people improve. Probably we will not be able to heal them, but to make their life easier and to decrease the level of pain chronicity is something that we can do quite well. These are our partners. Thank you so much to everyone who have joined this initiative. The DermGuard is a special partner, dermatologists who provide care using the same principle. And I also use this service for myself and for my soldiers that we had to treat in the field, in the combat field. So media support and our team, I would like to acknowledge the huge work of Vasyl Goroshko. He is our scientific consultant. Also to acknowledge other members, Alexei Dachenko for his IT support. Also, I would like to say that everything that you've seen was developed free of charge. No even grants were used for that. So we've applied for more grants, and now we are looking into programs for case-based training for family physicians. We are going to develop this program, and we are going to launch it first quarter of next week because we need follow-up. And family doctors, family physician is the physician who a veteran or retired veteran will go to first place. Say, for example, retired because of the amputation. For example, so please come to us, refer to us, please use this very short address. These letters come to me. We review them in a very timely basis, promptly. And of course, we need to talk about standardization of care. And thank you to other speakers for mentioning that. So we are ready to take care of everyone who needs that care. Thank you for your attention. Thank you. Mr. Valentyn, of course, we cannot just leave you without any questions. Dear friends, if you do have questions and you have mentioned that your doors are open for cooperation, if it's not a question but offering or proposal, also you can do that. So questions, proposals, suggestions, not wasting any more time. Anyone? Thank you. Thank you. I'm sure that we will have one more panel discussion and there'll be opportunity for communication later.